Folks, welcome back to another episode of the GPH podcast. We have so many superstar students here at GPH that do very interesting things. They have their own unique journey, and we're here to represent another journey here for all of you today. We have Whitney Rigodon. Whitney is about to graduate in 2026 with the Master's in Public Health, and Whitney has actually done her undergrad in Bryn Mawr College in anthropology, which I've heard a few episodes about anthropology, but we'll dive deeper into it and her public health journey. I would say in my interaction with Whitney so far, if Overachiever had a title, it goes to Whitney. Whitney has been involved on so many organizations, research projects, clubs over here. She's even started her own club. So how to maximize your time here at GPH can really be exemplified in this individual. We're so excited to speak to her. Whitney.
Hi.
Welcome to the GPH podcast.
Thank you so much.
I asked this question just to kick us off. What was your introduction to public health? How did this even start for you?
Of course. So my introduction to public health kind of is a very broad live life experience. So in the beginning, I was born in Brooklyn, so a very urban area, and we actually attended a lot of different kind of community events, but specifically I grew up in a church in Brooklyn. So throughout my life, I kind of was attending services, and one thing that kind of on the sadder side, but we would go to a lot of funerals. And I think when I was younger, I was like, what is kind of going on? We were attending funerals very often. So I was asking my mom questions regarding of hey, what happened? How old were they? And questions kind of revolving that type of area. And the older I got, I was there were kind of common patterns. So non-communicable diseases or diseases that are not get spread very easily. So things like diabetes or heart hypertension, heart disease, things like that, or chronic liver cancer. And at first I was kind of just these are just seems like an occurrences of really unfortunate events. And then the older I got, I kind of saw well, maybe air pollution's a factor that kind of promote early premature deaths. So kind of at an early age, I was I want to do something. So first step, I was kind of helping my family out in smaller circles. So then from there, I found a love for volunteering. So then I became able to volunteer at the hospital in New Jersey. So when we moved back to Jersey, and I think I noticed a difference between the urban living lifestyle and then between suburban lifestyle. And I was how come some of the diseases or health occurrences are happening in New York or not happening in New Jersey? So from there, I kind of developed a love for health and how to figure out what are kind of influencing these things. So from there, I attended college. I got my background in anthropology, which you heard from, and then I was able to learn about social determinants of health, which are the non-medical things that kind of influence health overall, and saw that these patterns that are affecting the community that I love in New York and the community that I learned to love in New Jersey, and I kind of said, how can we improve this overall? So from there, got my anthropology degree, and now I'm here at NYU for community health science and practice to kind of figure out how could we uplift our communities both in health and to make sure that they live longer lives and healthy lives on top of that. So that kind of pushed me to get into public health from there. And yeah, now I'm here.
Okay, so we need to break that down.
Yeah, a lot.
A lot. Anthropology is very interesting to me.
Yes.
So first off, what you experienced at a very young age is a visceral moment to showcase what impacts it had and how public health came to you as something that was a part of your circumstances. That you were seeing this every day, and it's what is going on?
Exactly.
How do I don't like this, and then I want to be a part of making sure this doesn't happen again. So that's what I found very unique to you, that you experienced that at an early age. And then how did you end up in anthropology? How does one decide I'm going to go into anthropology?
When I was an undergrad, at first I was first we kind of learn about health. We think of biology, and we think about how the body kind of functions, and you're well, maybe there's something else going else there that we can kind of intervent or circumvent. And then I kind of was in my intro biology classes, and I was getting I love what I did. I love my pipettes. I love running all these different biological assays and things like that. But then
what's an assay?
An assay is an experiment. So just another word for it. And I think through my introduction class, I kind of was trying to figure out, I feel I was missing something. So first year went by, and then second year I was biological anthropology introduction course. And I was let's just try it out. Who knows? And during my first semester, just sitting down in my first class, the thing I was missing was there. It was connecting how humans throughout, it was a very large like influx of like Homo genus, which is humans are Homo sapiens. So kind of studying that, I was able to figure out human factors and then tie in the biology aspect, which I learned, so that we talked about evolution, other things like that. And then also how that affects the human species as a whole. So anthropology, very, very big field. There's 4 subcategories. So usually people come from either biological, cultural, linguistic, or archaeology. And I know it's kind of like, how does that all equal to public health? I think one really good thing that anthropology teaches people is about intersectionality. So the idea that humans come from different places, they have different cultures, whether that ties into religion and other things like that. And from there, we kind of push through there to understand that everyone has their own experiences, their own ways that they do life, whether it's through food. And that kind of introduces people to welcome those thoughts. So ideas that may have been closed off to be like, oh, this is the best way for things to be, which is something called ethnocentrism. Anthropology really opens the field to cultural relativism, to look at the whole person holistically. And I think I really enjoyed that from that one class. And I think I've been in anthropology ever since. So to kind of look at someone holistically through an interdisciplinary lens.
You were noticing something in your neighborhood, and you saw that in other neighborhoods people don't probably face this as much as what you're seeing. And then it almost seems like you had a way to define that through a class, and like, oh wait, this is simplifying something that was unknown territory to me, and now I can finally understand it and solve this issue, which is so specific. Like one wouldn't think that anthropology is actually that. It feels like this concept I can't understand really. Like, oh, what's this weird thing that people talk about? But it's so specific and necessary for the world. Do you still have like anthropology that comes into your work right now?
Like a specific field within anthropology?
Like does anthropology split up into small fields?
Yes. So the 4 subsections that I talked about. So we have our little cultural section, biology, and linguistic and archaeology. At least for right now, I don't talk about too much about archaeological, but I do see the importance of it, especially when I'm kind of in the field. So something that anthropology, the skill set, is called ethnographic. So that means when people kind of go into the field and they write down things that they're seeing, the way that humans are interacting, maybe this store is really popular on this block, or maybe the music that's listening, or the linguistic aspect of a neighborhood, like what languages are they speaking? I might be able to pick up on something there. And from that, specifically with community health, it's kind of like one giant part that we do is like needs and assets evaluations, which is kind of like the first start of any huge project specifically within public health. So I think specifically for anthropology, the things I learned within biology and cultural come up very often, and specifically within linguistics. So maybe I'll notice like different dialects and be like, why in this neighborhood maybe one dialect is more prominent versus another one. So I think in my field now, all of them come help interact with each other, but I think I really enjoy that overall.
And then how did that bring you to NYU?
So for NYU, my senior year, we did a thesis. We could pick any topic you wanted. So I kind of noticed that I really did love that bio and cultural aspect of anthropology, and I really wanted to do something within the realm of medical anthropology. So from there, I did my senior thesis about mobile clinics in North Philadelphia. And from there, I was seeing how much of an impact mobile clinics were doing on the community there. And it really brought me an interest of how important interventions are. So from learning about how interventions can really change fundamentally people's lives, especially those who are going through really tough hardships and whose social determinants are more on the socially disadvantaged and clinically vulnerable side. I kind of was like, I really want to be part of that really great work that is changing people's lives and being a changing agent in the community. So during my senior fall, I was trying to feel like I have the great ideas of like the work I want to do, but I really need the skill set. So I was looking through so many master programs, and I was like, concentrations maybe more on the social and behavioral side, but NYU's program specifically for community health science and practice drawed me to it because they promised to give a specific skill set. And I really wanted that skill set to know what the work I wanted to do for the after effect. So I sent in my application. Luckily, I'm here now almost a year and a half later.
You seem like you have a path and like you're curious about that path, and then you just go all in and you find that direction to solve the issue that or the skill you desire. What happened for you when you joined NYU? How did that journey evolve for you? What did you get out of this experience so far?
I kind of had a wet lab experience, and then I have a qualitative side and a quantitative side, and I think I had the skill sets that maybe weren't technically for public health originally. So even though public health is a super broad field, I think I was really nervous when I was first joining NYU saying like, I can do really good qualitative research, but is it really something that I can offer? So ideally, I remember the first semester here at NYU, we did epidemiology, healthcare policy, social and behavioral health within a global field, intro to global. And I kind of was trying to figure out, like, this is a lot of information all at once. But I think they kind of call your first year the foundational year. And from there, I was able to gain all this really good skill set and all this really good foundation to kind of traject into the right direction exactly. So NYU at the beginning is kind of like, you're like a little overwhelmed. You're like, this is so much information, but it's really vital information, especially if you want to make an impact. So I think at first it was kind of like, how do I tie all this together? But the more week by week you see how public health is so intersectional, like so much intersectionality that there's no way that you can touch one field and not the other. So there was repeat themes, and then I was able to use the education I had from undergrad with anthropology to integrate it now and kind of see my strengths. And even though my weaknesses maybe at the beginning of the program were probably like first time I took epidemiology ever, and then now I consider it one of my strengths because I'm able to read papers now and see, oh, this is the odds ratio or this is the risk ratio, and use that type of skill set to pick interventions that might be more fitting for some communities versus some that aren't.
It's like there's this path you keep coming, and what we spoke about and what we read as well is that there are these different paths that have pockets of involvement you have had at NYU since you got here. So here you're understanding how to solve that problem you had. But what are the other pockets you picked since you came here to NYU? I see that you're in labs,
yes,
clubs, many different organizations. How did that start for you? Which ones stand out to you?
For labs, I joined Applied Global Health Public Health Initiative, or AGPHI, my first semester.
Do they call it AGPHI? What do they call it?
That's a great, one thing about public health, they love their acronyms. But I think we call it AGPHI. But the good thing about it is...
It changes with every episode.
Really?
I hear that about, yeah.
Really? Oh, maybe I'm not in the loop as well.
No, but AGPHI?
Yeah. I think I really wanted that hands-on experience again. So have the ability to research a culture, research maybe a location very, very well. But it's kind of like, what do you want to do there? And APGHI gave a really good skill set of like, they had a bunch of locations and we were able to join there. So it was like an open application. I was really lucky to be one of the few community health science practice people in the lab. And from there, worked on a bunch of teams, got to really work on my qualitative skill set. And then I saw the importance of program planning and evaluation during my first semester there. And then within that same semester, I was really lucky to Dr. Guasafero, who is, maybe I should explain this first. NYU's, each department applies you to a mentor or match you to a mentor. So thankfully to Katrine, I got matched with Dr. Guasafero, who also has a background in anthropology. See the loop for everything. But she was actually able to guide me through my first couple steps. And I was like, I really want to do more research and more hands-on work, but I need help getting there. So she was actually able to connect me to Dr. Geneva Murray, who's in the healthcare policy department, who was also another anthropologist. And she was really wonderful with helping me kind of see how my skill set can be applied to public health more directly, and specifically within, again, the beginning stages of a project to make sure it's set up for success. So whether it's like learning how to do stakeholder analysis or preparing interview guides or being ready to learn how to code and listening to interview tracks to be able to see how questions can be directed to understand the full picture or someone very holistically in that matter. So from the research side, I was able to join so many different labs, and now currently I work as a research coordinator for Safe Futures. And that has been a really great joy. So the topics within NYU are so broad and really wonderful. So I started out in rural health. I went to maternal health. And now I work in prevention of children maltreatment. And I think the ability to jump around so many topics is the wonderful thing about the NYU staff here, is because they're so diverse. And maybe one moment I thought I was going to stay specifically within urban health, like at the beginning of this program. And now seeing how much information and so much skill sets I learned within my time is like a really beautiful feature of NYU.
Such an interesting access to resources.
Yeah, absolutely.
That one wouldn't, like, you just don't stop.
Yeah.
You kept going, like, interest, new interest. And you had everything available to you, it seems.
Absolutely.
And wow, I just had to point that out. Like, you see, like, everything's available at school, but sometimes students don't know how to find it.
Yes.
And sometimes students don't find the pressure to locate it. And I wonder how you did that, like, for yourself.
The mentor-mentee program was a really great window, but the really great thing about student affairs or the emails that we get, and we get a lot of emails, but the good thing about even just keeping that on your radar is that NYU really wants you to succeed, and I feel like the environment here is truly trying to push you for that. Whether it's through your professors, like taking the time to tell you about conferences that are going on, or letting you know, like, hey, this is an online option, or if you want to attend this workshop. And the environment to help you succeed is like, oh, I have a question about this one thing that you brought up, and they're willing to like stop whatever they're doing to like give you a moment, because they understand that you just need one door to be open to fully succeed. And I think more specifically, NYU is really great with inviting guest speakers. So let's just say I know Student Affairs has like a really great workshop series or a great like conversation series that allow you to talk to people from the private sector, public sector, or pretty much anywhere. Like, you've imagined that they probably worked with someone from there. So the idea that you're hearing all these like wonderful different stories from people in the field, and it kind of helps you pick what direction. And I think one of my favorite questions always to ask is like, how did you get there? Because again, whether it's through similar stories of like, maybe I stumbled somewhere and I really found out I really love it and I stayed there, or maybe it's just like it allowed me to connect to this person to get to this person to finally get to where I need.
Fascinating. Like, yeah, there's one connection away to everything.
Absolutely.
And just ask. Everyone's here to help each other. What's you were telling me about the labs after that?
Yes.
So I would love to hear about that.
Sure. So one really great thing about labs is that at the beginning of orientation, there is kind of like a Resource Expo Fair.
Okay.
And the idea of...
Oh, yes, of course. That happens every year.
Yes,
over here,
absolutely.
On the third floor, right?
Yes. So that's more towards undergraduate. And then our graduate one is like kind of after you do your introduction to like the school. So you get to hear from Dr. Melody Goodman to literally everyone in student affairs and everyone in between, to kind of give you a really good introduction and make sure you get introduced to the resources that are available to you at your disposal. So Resource Fair, it's, if not every lab, every club, some people that work within NYU, maybe not GPH directly, but maybe sometimes we, again, intersect at different things, because whether it's with the School of Social Work or School of Professional Studies, there's a lot of intersect specifically with the professors. But back to labs, I kind of just was walking around the Resource Expo Fair and was like, I'm going to take that. You never know. And I got to meet KDO, AGPHI, Safe Futures. And again, they really want you to join their labs because they believe that you have a skill set to offer. And yeah, so just, again, one door just needs to be open, and the willingness to be able to jump from topic to topic or be willing to open to any door.
KDO, we have had Dr. Collins on the podcast before. And can you tell us, so you seem to be quite involved with that lab.
Yes, I used to be.
You used to be
Yes,
involved? So
yes.
tell us about that experience.
Sure. So really one great thing about KDO is that they have a lot of work with different professors. So the work I did with Dr. Murray was actually under that. So it was more on the qualitative side of KDO. So we were able to at least start a project or kind of like get a project up and running. So again, I did a lot of research with social services, and she was the one that kind of taught me how to prepare a project to be ready for like bigger implementation. But yeah, we were like phase 1 at the time I started.
A bigger implementation of what?
So she's does her research specifically how to integrate social services with medical integration.
Okay.
So she kind of was trying to figure out at the time how to make an intervention package by creating those two things. So I was trying to figure out what are some social services in New Jersey that would help with maternal health at the time. And we were just interviewing people before, yeah.
To get there. We were chatting offline, off camera, about your world. Your world is entering implementation science as your biggest area of interest right now. Was KDO the introduction to implementation science? How did that come up for you?
I actually was able to attend a talk from AGPHI or another lab on campus that works specifically with implementation science. And I think, again, I've really grown a love for program planning and evaluation and the importance of those two things, specifically to make sure that any project starts off on the right foot. And I think I read a study that it takes approximately an NIH study that it takes approximately 17 years for evidence-based or specifically research-based practices to be in real clinical use. So I think when I first heard that fact, it was like 17 years is a long time. And I think the idea that implementation scientists really want to bridge that gap. So the work that labs here on NYU, whether it's working with different frameworks, we use a lot, but specifically within implementation science, they use REAIM, reach, effectiveness, adaptation, implementation, and maintenance. And it kind of reminds people that this process is cyclical, that one thing that you can't just create a project and just leave it. You have to make sure that you're checking in, making sure that your indicators are actually evaluating what you want to check in on. And one really great thing that Professor or Dr. Tozen, who teaches program and evaluation, keeps on reminding us is that this project has to be, you have to continue to check in with your project and check in with your stakeholders and the people that you're supposed to be helping. Because not only is it your responsibility as a public health professional to do that, it's also your job to make sure that point A to point B to make sure that the good faith in public health remains. But yeah, so implementation science is the idea that to reach evidence-based practices to real clinical use and make sure to bridge that gap.
Where did your interest spark for this field?
I believe that there's so much great work happening all around the world, like genuinely, whether it's from different countries, maybe something that works. I think within a lot of research, specifically with community health, I've been seeing is that we've been actually able to implement other interventions from other countries and then change it up maybe so that it fits the population that we want to serve. So let's just say that specifically with home service or home visitation programs for postpartum individuals, maybe we should be focusing on like maybe the time. Maybe in one country they're able to do weekly. Maybe they have enough like personnel to do that, medical personnel. But maybe in the States we don't have that many personnel. So maybe we can do like a 3-month, and maybe 3 months works better for the population so that they could be home on some days. So the idea that we have all these wonderful ideas happening in the world, but to be able to modify them to serve the population that you want to help. And I think I really want to be part of that, finding them. And that's where the global aspect of anthropology comes in, to modify them, to make sure we hear community voices and incorporate them, to then making sure it rolls out as effectively as possible.
Because you have to check in.
Oh, absolutely.
That's the part. What's your public health dream right now?
My public health dream, at least for the world specifically, I think in an ideal setting, it'd be that everyone in this world could wake up and look forward to tomorrow. We understand like within public health, again, we deal with clinical, mental health, environmental, nutrition. There's a lot of factors within the world that kind of make people not feel hopeful. And the idea that if every public health professional can be able to create a future where people are excited for tomorrow, and maybe that can start today, whether it's you working within your little community to ensure everyone has the resources they need. But that would be ideally my public health dream.
That's beautiful.
Thank you.
How has NYU and this entire NYU experience helped you get closer to that?
I think, again, the environment here at NYU is probably have been one of the most best experiences for me. I come from a really small college, like maybe like 1,200, 1,300 people. So very small. And the really great thing from that experience is that I could literally know almost everyone in my grade. And then from NYU, could not tell you how many people we have. Like, I think recently I was like 900 something, and I was like, oh, that's more than my class. But I think the really great aspect of that is that you never know who you're going to meet and how different their journey to public health has been, and how you two can work together to make a project together. So ideally, whether it's through clubs like the club you mentioned earlier, which is Health and All Policies Network, my friend Gravir Sidhu actually created it, and we're part of the founding e-board. So luckily through him, we kind of were able to see this gap in the program where we're like, oh, health and all policies, like it's a really great thing. We all understand it. We all really love it. And the fact that we were able to make a club to kind of serve the community in the whole and teach the community about how to integrate what we've been learning in class in real world implementation again. And I guess how NYU has also been able to help me get to the goal I really want to, of making a better future for everyone. The foundational classes that we've had, again, I had the skills, maybe didn't have the skill set to really make my dream of making maybe intervention packages for everyone in this country to make sure they have a successful life and a happy life on top of that. But the idea that professors give you the course load not because they want to stress you out, but because they believe this is the work that you need to become successful in the work that you need to do. And I think having those moments of vulnerability of being like, I actually don't know what you're talking about. And for it not to be filled with ridicule, but actually like, hey, let's take a moment back. Let's take a step back and see how does this fit into the larger picture in which you want to like help out with. And you see that in the environment that you do in labs, from the classrooms that you sit in. Maybe luckily we have a very big class, so very vast age range. So maybe some people are more down in their public health career compared to a few of us that are just starting out, and they take the time to kind of offer like, hey, maybe we can, this is something work that I've done, or maybe that's something that you want to do in the future. I can connect you to this person. So again, I think the environment of just like everything is possible. Like you can have your idealistic values, but give you a realistic skill set to reach those goals. And I feel like, especially now, to kind of do real world implementation, you need to have that mindset.
That's so beautifully put in such a detailed manner. I'm glad that this place has been so wonderful for your journey and opened up portals that you never thought were imaginable. I'm sure you have inspired the next generation of implementation scientists and everything that's coming in the world of public health. You are one of those people that has made really, really good use of the program. And it's rare to find someone that is just, I'm going to see what's here. I'm going to see what's here. Based on what your needs are, you could probably find it at NYU, and you've just shown us that today. So you have one more semester, but whenever this episode comes out, you would probably be graduated out in the world doing amazing things. So we wish you all the best on your journey.
Thank you so much.
Absolutely. Thanks for coming on the episode. All right, folks, that's Whitney Rigodon. Find her everywhere, Whitney Rigodon, and we'll see you in the next one. Thanks for tuning in. Take care, everybody.